Well, good afternoon, everyone. It's good to be here again. I think there are two things that I'd like to focus on. One of them is Senate Bill 14, which I think you folks are familiar with. This is the bill one of the bills that came out of the Economic Opportunity Poverty Reduction Task Force, and it concerns the PTC rebate program, the Property Tax Rent Heat Rebate Program. We're doing a number of things in the bill, but what's most important, and one of the things that's most important, is that we, back in the summer of 2012, I requested a legislative audit of the PTC rebate program. I was granted that request, and they came back last year, I think it was in August, and presented their findings. So we're actually trying to implement some of the findings of the performance audit. Beyond that, we are looking to basically expand the eligibility, the income thresholds of seniors 65 and older who would qualify for the PTC rebate, surviving spouses 58 and older. So we're looking to increase the income threshold. We're looking to implement recommendations of the performance audit. We're also, I think many of you know that right now on the property tax rent side of things, the maximum grant that one can receive is $600. We're looking to increase that to $700, expand that income threshold, and then also we've set up what we're calling a flat grant amount, so that at a certain income level, you would be getting $227 on the rent heat. Excuse me, slow down. You would be getting $227 on the property tax rent side and $73 on the heat side. So you would get a flat grant amount for $300. Those of you who have been around know that the way it works now, if you exceed a certain income level, you ultimately don't get anything. And so that's the PTC rebate program. I just got an updated fiscal note because we made an amendment in Senate HHS. It was a technical thing having to do with what's referred to as the percentage reduction factor on the heat side. But anyway, the bottom line of the fiscal note is about $5 million. And again, we are trying to reach more folks. We've also created a hybrid between the Department of Human Services, which will do more outreach, more targeted outreach, working with community-based groups, working with the Department of Revenue, which will continue to administer the program. So we're trying to get the two departments to work together with community-based folks to reach more people and basically put more, in my view, put more money in people's pockets so seniors can have more options to live at home independently for as long as they can. That's Senate Bill 14. It's a great bill. Hope you'll help me get it out of appropriations. Piece of cake. The second thing I'd like to chat about, if I may, sure. And this bill has not been introduced, but I'm hoping it will be this week. Many of you are aware that I worked on the old age pension dental program, and I know at least Bill Hanna, in another role, was at a meeting we had on Friday. But essentially, we are looking, well, first of all, if you recall back in 2012, House Bill 1326, which I was in the House back then, seems like a lifetime ago. But I, with then Representative Cindy Acree, we ultimately sponsored House Bill 1326, which established a COLA for the old age pension program, and it also reinstated the OAP dental program, which had been suspended for about 4 years, I think. We were able to get $3 million to OAP dental, reinstate it, and actually include folks on the Medicare savings program up to about 135% of FPL. So with the changing landscape for adult dental benefits, Medicaid expansion, passing the bill that we did last session that allows for adults to have access to some dental care, we are looking, this bill that will be introduced, if not this week, the week after, move where it is now, the OAP dental program is a grant program. It's kind of a blend between grant and benefits program administered through CDPHE, the Department of Public Health and Environment. We had 4 options on the table for discussion on Friday, and the 2 options that were left standing, one of them would move the the program over to the Department of Healthcare Policy and Finance as a grant program, and of course there's a lot of details in there. The second thing, which is I think the second option, which is still on the table, would actually move the administration. We put out an RFP, and a not-for-profit, a foundation, like, for example, Caring for Colorado Foundation, which has a lot of experience with dental programs, conceivably would bid to administer the program and then provide grants like we're currently doing, working with AAAs, working with a variety of other things. So that's the second item is I'd welcome your input. I'm happy to give you more details, but we are looking to move OAP Dental out of CDPHE through a bill this session and either put it with HCPF or possibly put it with a foundation. And the goal is to target the dollars to provide wraparound services for folks who have a $1,000 cap, and to also target it to those folks who might fall between the what do they say when you fall through the safety net? What do they call it?
Cracks.
The cracks. Those cracks. You know about the cracks. A lot of folks sometimes fall through the cracks, and we're trying to minimize the number of folks that fall through the cracks. So, thank you.